Okay. We will go ahead and convene again. We recessed at 1:30, so we're back in session, and no need to call the roll. We had rolled several bills to the heel, and Chair Lady Moody, we're going to go ahead and recognize you on your bill.
Item 8, House Bill
2416, item 8. We have a proper motion and second on the bill. And
Thank you.
I think there's an amendment that makes the bill.
Yes, sir.
Okay.
It
And
is.
I would ask for a motion and second on the amendment. We have proper motion and second on the amendment. We will put that amendment on the bill. All those in favor of amending the bill as spoken, say aye. Any opposition?
Do you get the drafting code?
Oh, could you give us the drafting code?
Yes, sir. 015315.
That's it. We're on the bill as amended. You're recognized for an explanation.
All right. Well, thank you, Mr. Chairman and committee members. What this bill will do, it's already in law and statute that in Tennessee, we do not do telehealth chemical abortions. And so we did notice that we didn't put any teeth into it. So what this bill will do is it creates a Class E felony for anyone who intentionally, knowingly, or recklessly violates this act. And I'll keep it short in case there's questions or.
Okay. Do we have any questions or comments on the bill as amended? Give us a minute to look over it here. Apparently, nobody's got anything they want to ask about it. Speaker Marsh, you're recognized.
Thank you, Mr. Chairman. And can you tell me exactly what the amendment changes that you put in there?
It's just adding the criminal and civil penalties.
And that's all it does.
Yes, sir.
Thank you.
Thank you.
We have further comments or questions. If none, we'll be voting to send this amended bill to full committee. All those in favor say aye. Aye. Any opposition? So approved.
Thank you, members and Mr. Chairman.
Okay, thank you, Chair Lady, and I think we can take care of Representative Harris. I think you've got a bill on the heel. Pardon? Oh, anybody who wants to be recorded as a no, let the clerk see your finger or your hand. Representative Harris, you are recognized on House Bill 2259. It has proper motion and second. And we have an amendment that makes the bill. I will stand for the motion and second on the amendment. Do you have the drafting code, sir?
Is that, Chairman, is that 015240? 015240, yep.
Okay, that's it. All those in favor of the amendment, say aye. Aye. Any opposition? We're on the bill as amended.
Thank you, Chairman. I also have a untimely amendment as well, which changes one word from shall to urged. And so that amendment is 015393.
Okay, is there a will of the committee to accept this untimely amendment? Consider it. Any opposition? If none, we will. We can put that on after we discuss it.
Yeah. Okay. As long as we have a motion and a second on it.
Okay. Do we have I tell you what. Let's discuss the bill as amended. Do we have a motion and second on the untimely amendment? We have proper motion and second on the untimely amendment. We will take that up after we discuss the bill as amended. So you're welcome to explain the bill as amended.
Thank you, Chairman. So this bill is already passed in the Senate passed through the Senate floor already. But what this bill specifically would do would urge our practitioners to discuss with our patients that are minors or emancipated minors and their parents when they are prescribed opioid drugs. So,
Let me say, before we get into the discussion, I'm told by the analyst here that the amendment, the untimely amendment that we've considered, does not fit with the amendment that makes the bill. Yeah, that we've already adopted. And so we're in the posture to consider your caption bill as amended, which amendment makes the bill, but the other amendment does not fit
Okay, so,
legally. So, is that correct?
yes, sir.
So how essential is the amendment that you're,
Well, technically, I believe this amendment technically would make that bill, because all we're doing ultimately is changing, right now, the ability for a practitioner to urge a discussion with a patient when it comes to opioids that are prescribed out to a minor. And so it's the same amendment that passed on the Senate floor.
let's go out of session if there's no objections. I'll let our legal analyst explain this. What we may need to do is reconsider our action with the untimely amendment.
Okay.
So that we can make your bill as amended work. So no objections, out of session.
Rajul Bajoy, Office of Legal Services. From my understanding, the committee just adopted amendment number 15240 on House Bill 2259. And as a result, the amendment number 15393 no longer fits on the bill as amended. It does fit on the original language of the bill, but the language it's referencing in 15393, that language no longer appears on the bill as amended.
So what I'm understanding is if we reconsider our action on the first amendment that you said made the bill, reconsider our action, do not place that amendment on the bill, we can put your untimely filed amendment on the bill. Is that?
That's exactly right.
Okay. So no objections, we will go back into session. And I will stand for a motion to reconsider our action. We have a proper motion and second on reconsidering the action of, which amendment is it? 15240. Any discussion or questions about it? If not, all those in favor of reconsidering our action, say aye. Any opposition? So we are reconsidering our action on 15240.
393.
So what we need to do is take it off. Okay. So what I'll do is withdraw, yes. So I'll stand for a motion to withdraw the amendment. Have proper motion and second. All those in favor say aye. Any opposition? So approved. So we're back on the untimely filed amendment, which we have a motion and second on. Do you have the drafting code for the untimely filed amendment?
There's got to be a motion to reconsider 15393.
So what we'll be doing is putting that on the, yeah. 15393. We do. And we already have a motion and second on the untimely. We've already put it in, agreed, no objections to recognizing it. So all those in favor of the amendment as stated, say aye. Any opposition? We're back on the bill as amended. and you want to explain what is unexplainable.
Yes, okay, so for this amendment, all it does is makes the change to urge our practitioners to discuss with the patients, the minor patients and emancipated patients as well, to their parents when prescribing opioid drugs over a certain amount of days. In 2014, the TBI launched a program to provide handheld auto injectors to agents and forensic scientists in the labs who may come into contact with phenolin. And so now, they did not contain oxycodone, but instead contain phenolin. The safety concern of this discovery is so great at the TBI issue, a warning about this potential dangerous drug recovery. And so opioids is also a huge issue that we have across the state. And so this bill simply is just so that our practitioners would urge to tell the information about what this drug is to the patients that are minors.
Okay. You recognize Coach Byrd, Chairman Byrd.
Thank you, Mr. Chairman. I'm just curious, why did you change it from shall to urge?
So we had.
You're recognized, sir.
Thank you, Chairman. And so we did have some slight pushback on the amount of paperwork that it would cause a doctor to have to do when it comes to actually telling a patient about why this drug could be harmful. So we had to make some alterations, but there are some doctors that still would like to be able to tell this information. So instead of requiring it, we are urging it now.
Okay, thank you.
Chairman. I think Chairman Jernigan, you were next.
Thank you. So just I think I got what you're doing. So the practitioner urges the danger of mixing opioids with different other substances, correct?
That's correct.
Okay, thank you, sir.
And Dr. Kumar, you're recognized.
Thank you. Thank you, Representative Harris. Does this bill apply to all patients or only to minors and emancipated minors?
Representative Harris.
This bill specifically was for minors and emancipated minors only. This is not dealing with actual adults.
Chairman.
Certainly, I think most of us are aware that for any drug a doctor that prescribes, it is part of our interaction with the patient and our duty to explain the side effects and risks of it. So it applies to opioids and benzodiazepine even more than it does direct. So it is standard practice, and I think you want to urge doctors or prescribers to go ahead and explain that, but I'm glad that you're not making it mandatory because it's not necessary, because then we'll be regulating the practice of medicine.
Absolutely.
And with that posture, I think it's a reasonable thing to do. Thank you.
And Representative Harris, I'm told by a legal analyst here that actually this bill language applies to all patients, but it applies with an urging message rather than a mandate. Dr. Kumar, does that cause you different concerns?
No, sir, I'm okay with you.
Okay. Representative Harris.
Thank you so much for saying that. So, of course, the original, I'm going back, I keep going back to the original bill. We did make a change based off of current law that we already have in practice, so that way we weren't requiring additional work for our medical providers. But the original amendment was specifically just for minors and emancipated minors. And so now that we're just specifically sticking to just urging, we're just keeping it to overall everyone. So.
Okay. And Dr. Terry, you're recognized.
Thank you, and I may need to go out of session and speak to legal on this, but from what I'm reading on this amendment, there's two sections, and what I want to get clear, the first part is, it says we're deleting a practitioner shall discuss with the patient, and we're substituting a practitioner is urged to discuss with the patient. So what are we urging them to discuss, and no longer shall discussing with the patient?
If there are no objections, we'll go out of session and allow testimony. You recognized.
Rajul Bajoy, Office of Legal Services. As amended, the language of the bill states that a practitioner is, under subsection A, states that a practitioner is urged to discuss with the patient or the patient's parent or guardian if the patient is under 18 years of age and is not an emancipated minor, the risks associated with the drug being prescribed, including the risks of addiction and overdose associated with opioid drugs, and the dangers of taking opioid drugs with alcohol, benzodiazepines, and other CNS depressants, the reasons why the prescription is necessary, alternative treatments that may be available, and risks associated with the use of the drugs being prescribed, specifically that opioids are highly addictive.
Chairman,
So if this bill passes, they no longer are required to discuss that with an emancipated minor?
Rajul.
So under current law, and under 63.164, a physician in certain circumstances, when providing an opioid prescription over 3 days, is required to get informed consent from the patient. This bill, as it's now amended, doesn't change that section at all. So that requirement still stands, and those provisions in 63.164 still stand. This adds a new section urging practitioners in all cases with all patients to provide the following information, but it doesn't establish a mandate.
Dr. Terry.
So this isn't just applying to an unemancipated minor. It applies to all patients that the physicians are urged to do this even under prescriptions below 3 days.
Mr. Bajoy.
That's correct.
Thank you.
Further questions of our specialist? If not, we will go back into session. And do we have discussion? Dr. Terry, you're recognized.
Thank you, and I appreciate the sponsor for looking into this. And the words mean things, and you weren't here when we went and did the Tennessee Together part where this was put in place, and that was a significant amount of time and effort that we worked with the Senate, Lieutenant Governor, the Governor, the Speaker. In fact, he was Chair of Health when that came through. This past year, we had a part of that legislation came forth with a review, a mid-10 together review, and the whole purpose of the 3-day notice was to get less prescription or get more prescriptions under 3 days and not get them into that 4, 5, 7-day prescriptions where the risk ends up going up that slope. And again, you did mention earlier that there was some paperwork, this, that, and the other, and oftentimes I call that the headache to healthcare ratio. But there's a reason why we did not do things like that for those below 3 days. In practice, this may not change what somebody does, but the concern for me would be that, well, you were urged to do this and you didn't. Now explain that, in a court or whatever. So I understand why you bring the bill, knowing what that we've put into it. I'm not going to be able to support this, but I understand why you brought it. Thank you.
Representative Harris.
Oh, thank you so much.
Do we have further comments or questions? Oh, I'm sorry, Chairman Boyd, you're recognized.
Thank you, Mr. Chairman. And sponsor, I appreciate your passion for this and your willingness to amend the bill to accommodate the stakeholders. But every once in a while, as you amend a bill, you water it down to the point that it doesn't really do anything. And in this case, I think we're almost to that point now. And we're putting something into statute that just urges something. And I wondered if you really want to urge something, if maybe you might want to do a resolution or something and just take this. I mean, that would be my recommendation, is perhaps take this off a notice and do a resolution and run it to the floor and pass it that way. I'm not sure that the bill really does anything anymore. And then having that in statute, as Chairman Terry implied, it could cause issues if there were ever a court case or anything. So that's just a recommendation I'm making to you.
Representative Harris.
Yep. So thank you, Chairman. So I would thank you. I appreciate that, but I definitely want to go ahead and move forward with it. It's something that we did work deeply hard on Obviously, we have a huge concern for making sure that everyone is aware of the drugs that they are being given. And so if and I understand that the workload that it does add to a practitioner, however, I do want to make sure that we do our absolute best in making sure that although they may do it in practice, that we do our absolute best to urge and try to eventually get to the point where it is a required statement that maybe one day we'll be able to work towards. So,
Further comments or questions to the sponsor? If none, we will be voting to send this bill as amended to full committee. All those in favor say aye. Aye. Any opposition? No. Sorry, the bill fails.
thank you so much.
We have, I think Representative Powell came in. We had rolled your bill to the hill. Have a proper motion and second on the resolution. I think you intended to speak to us about it. You're recognized, Representative Powell.
Thank you, Chairman, members of the committee. So this is a House Joint Resolution that would create a constitutional amendment for the cultivation, the growth, cultivation, usage, and sale of medical marijuana in the state. 4% of the revenue from that, or medical cannabis, 4% of the revenue from that would go towards veterans' health care. So, I know there's another bill that I'm also favored and support, but I think that ultimately I'd like to see this move forward just as a backup plan, because I know if the legislature continues to not be able to pass a true medical cannabis program, I think this is our best effort, is to have a constitutional amendment and ultimately let the voters decide and put this in front of the voters to have a constitutional amendment for medical cannabis in the state of Tennessee. With that, I renew my motion. Have any questions? I have an answer.
Okay, does anybody have any questions on the resolution of the sponsor? We will be voting to send this resolution to full committee. All those in favor say aye. Aye. All those opposed? No. I'm sorry, your resolution fails.
We'll try again next year. We got 4 more years.
This portends badly for my calendar. Is that it? Okay. It's
Item 21, House Bill 184 is the next one.
I rolled it on to the hill.
You rolled that one?
Yeah, I rolled that one to the hill.
Okay.
Oh.
22.
I rolled 21 to the hill.
All righty. Item number 21 had been previously rolled to the heel. So that brings us to item number 22, House Bill 0946. You have a motion and a second. And Chairman Ramsey, you are recognized.
Thank you, Mr. Chairman. This bill is as amended, and I have an amendment on it, 5468.
Okay, we have an amendment 005468. I need a motion. You have a motion, a second. Okay, amendment's properly before us. Do you want us to put that on the?
Yes, sir.
Okay, without objection, let's go ahead and vote on amendment 005468. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bills committee. You are recognized.
Thank you, Mr. Chairman. As amended, this bill will update current public health policy concerning the prevention and treatment of STDs. Our state has a long-standing comprehensive program in place to address continued problems of STDs in adults and teens. The program that the state has adopted for a long period of time, the mission is to prevent, control, and treat the spread of sexually transmitted diseases. Nationwide, we have 20 million STDs newly diagnosed each year, and of those, half the patients are between the ages of 15 and 24. It costs the health system for the United States $16 billion per year, and we're in the 6th year of consecutive record highs for sexually transmitted diseases. Currently in code, there is a specific subsection that establishes which providers may treat minors with STDs. These include physicians, supervised nurse practitioners, advanced practice registered nurses under appropriate supervision, and physician assistants with appropriate supervision. Also, any state, district, county, or municipal health officer may treat these minors with STDs. Currently, the law reads, healthcare officers and providers licensed in the state may examine, diagnose, and treat minors infected with STDs. This bill, as amended, would change the current law to allow minors to receive preventive treatment as well. So essentially what this does is add the new language for being able to provide consultation and prevention, moving us toward treating fewer and fewer, hopefully, teen STD cases in Tennessee. So with that explanation, pending questions, I would ask that you renew the motion.
All right. Any questions for the sponsor of the bill? All right. Seeing none, we are voting on House Bill 946. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to full health. All right. That brings us to item number 23, House Bill 2531. Chairman Ramsey, you recognize. You have a motion and second.
Yes, sir. Thank you, Mr. Chairman. I have an amendment 14047 that makes the bill.
Okay, amendment 014047. Okay, I need a motion. You have a motion second properly before us. Do you want us to put that on the...
Yes, sir.
First, okay, without objection, we'll be voting on amendment 014047. All those in favor say aye. Aye. Opposed? Ayes have it. Bill's back on the bill as amended. You are recognized.
Thank you very much. Mr. Chairman, we're in the middle of nationwide of a mental health counselor crisis. Part of that's because of the pandemic causing so much more stress. In the United States, 77% of counties have a severe counselor shortage. 20% of these counselors that we have are leaving their jobs each year, and we've made some advances like telehealth, salary increases, license reciprocation. But Marie Williams, our Commissioner of Tennessee Department of Mental Health, has asked for $70 million in the next short-term future and $300 million for future programs, knowing that we need to do all we can to improve the situation. This bill, as amended, was brought to me by the Tennessee Licensed Professional Counselor Association and was drafted in consultation with the licensing board's attorney. The update, what it does is update or delete language in the code that is either archaic or has been placed in regulations. Nothing in the bill changes the scope of practice for licensed professional counselors, and nothing in the bill affects any other mental health provider. The first section of the bill refines requirements for licensure. It removes required hours, which is in the regulations, and removes qualifications, which are in another section of the chapter. The second section states that a candidate for licensure must have completed supervised field experience. It removes the list of mental health providers because the list is provided in the regulations from the board. The term master degree in the third section is changed to postgraduate degree, and in the fourth section it cleans up language concerning temporary licenses and changes the term until the board grants or denies to at the discretion of the board, and adds a 1 year from 3 to 4 years on the span of a temporary license. With that explanation and pending any questions, I would ask you to renew the motion.
All right. Any questions for the sponsor of the bill? Seeing none, we are voting on House Bill 2531. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to full health. That brings us to item number 24, House Bill 2272. You have a motion and a second.
And thank you very much. I have an amendment 15714.
Okay, yep. We have 015714. You have a motion and a second. Do you want us to go ahead and put that on? It rewrites the bill?
Yes, sir. I would
Okay.
appreciate that.
Without objection, all those in favor say aye. Aye. Opposed? Ayes have it. Okay, we are back on the bill as amended. Chairman, you're recognized.
Thank you, Mr. Chairman, and we all are seeing the facts from bill after bill. Drug overdoses continue to climb by 50% a year in Tennessee. Tennessee is the 40th highest in fatal drug overdoses in the population. Our average is 52 overdose deaths per 100,000 citizens, and the U.S. average is 30, so we're almost twice that in Tennessee. In 2017, drug abuse and fatal overdose. Should I dance? Fatal overdoses cost the U.S. $550 billion in health costs and lost productivity. What this does is creates, as amended, creates the Overdose Fatality Review Act, which creates a framework for establishing county or regional multiple disciplinary overdose fatality review teams to examine and understand circumstances that are leading us to fatal overdoses. A lot of the information that comes from fatal overdoses is very difficult to put in categories because it's covered under the federal, I guess, protection acts. And so what this does is it's a permissive bill that allows local organizations to set up an overdose fatality review board. We have two of these already in the state. One's in Knox County and the other one's in Davidson County. And they're very productive. They tend to be able to put together a lot of information that ordinarily wouldn't be available from providers. And just to give an example, this kind of program, permissive program, was set up in Maryland, and in Maryland they discovered that a vast number of their fatality overdoses happened in motels. So what they did was establish a program to train motel employees to be able to use Narcan, so they could save some lives. So that's essentially the kind of pattern that we're using here, and we hope to make this permissive program available. It has a fiscal note on it, but I think it's probably somewhat exaggerated because it is a permissive program. And the people that are involved in it are volunteers, although they do receive some mileage. But I think maybe the catching on and use of this is going to be less accelerated than the fiscal note reflects, and I think it's probably going to be much cheaper than what's recorded here. So with that, I'll take any questions.
Okay. Any questions for the sponsor of the bill? All righty, and I do agree with you that sometimes these fiscal notes, we call them faulty fiscal notes. There's a little bit more to them, but all righty. Without objection, we are voting on House Bill 2272. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to Full Health Committee. All right, that brings us to item number 25, House Bill 2228. Okay. You are recognized.
Thank you, Mr. Chairman.
I need a motion.
I know this is your favorite. And it has
You have a motion, a second.
Has an amendment on it, 16191.
Okay. Amendment 016191. I need a motion. You have a motion and a second. Okay. You want us to put that on the
Yes, I do, sir.
Okay, without objection, we will vote on Amendment 016191. All those in favor say aye. Opposed? Ayes have it. We are back on the bill as amended. Chairman, you're recognized.
Thank you, Mr. Chairman. Of course, I just got through describing the situation with Tennessee and fatal drug overdoses. This bill, the legislature's worked tirelessly in the last 10 years to try to deal with these issues and making sure that accidental opioid overdoses are avoided in every way that we can. This will be a tool to help ensure patients are fully aware of risk and increasing the access to opioid reversal medication, commonly known as naloxone. What this bill does is amended, it requires a healthcare prescriber to offer, and that's just offer, it doesn't demand that they give one, but it requires that they offer a prescription for an opioid antagonist or a similar FDA-approved drug, which there are several. I think there's 6 companies that actually make these type of drugs. They are required to at least offer to a patient who is prescribed an opioid and that meets certain criteria. And this bill excludes people that are in palliative care treatment, end-of-life kind of situations, or just maintenance, and it also excludes prescriptions written by a veterinarian. How many times do we run across people that in sports medicine or some kind of injury that they've had, and they say, I got addicted, but nobody told me. So this is an extension of trying to let folks know that they are in a precarious situation. The 3 situations that it covers is, let's see here, if the prescriber offers over a 3-day supply of an opioid, if the doctor also writes a prescription for a benzodiazepine, which is a anti-anxiety medication like Valium, or if the patient has a known substance abuse disorder or a history of overdose. So that is that the patient discloses. Patients don't always tell the truth, and in that case, the doctor is not liable. But with that explanation, and I checked, I know some people had voiced the issue that there's a black market for naloxone, for Narcan. And so I kind of inquired of my pharmacist at home, and he told me that nobody ever comes to get Narcan. There's a standing order from the Commissioner of Health with collaborative pharmacies that you can go in and get it over the counter whenever you want it. And so he told me that nobody ever does that. He said the only times that they get it is when a pain management specialist sends an opioid prescription. He will send also a note that says no Narcan, no pills. And so that's pretty much what they see. So essentially we're trying to extend the loop of protection for folks that are under some sort of peril, and that's what the intent of this bill is. So with pending further questions, I will ask you to renew your motion.
Okay. Any questions for the sponsor of the bill? Withdraw. Chairman Kumar, you're recognized.
And thank you, Chairman Ramsey. What this bill says is that in case opioids and benzodiazepines are prescribed together in these certain amounts, then the physician will offer.
Yes.
Right? It's not that he will write.
No.
Thank you.
Yes, sir.
Any further questions? Okay. Seeing none, we are voting on House Bill 2228. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to full Health Committee. That brings us to item number 26, House Bill 2032. You have a motion, a second. You are recognized.
Thank you,
There's an
Mr. Chairman,
amendment.
and I also have an amendment that, to satisfy some questions that had come up, 15475.
You have a motion, a second on Amendment 015475. You're recognized. You want us to go ahead and put that on the?
Yes, sir.
Okay, without objection, we are voting on 015475. All those in favor say aye. Aye. Opposed? Ayes have it. We are back on the bill as amended. You're recognized.
Thank you, Mr. Chairman. And I love the old days of dentistry when alcohol and tobacco were the main things that you had to discuss with a patient about cancer risk and in dental office screenings. There's a new player on the block, HPV, which is a group of viruses, 30 of which are sexually transmitted with differing levels of risk for genital warts and cancer. This has become, as amended, this bill would authorize dentists to administer vaccinations for the human papillomavirus. HPV as a vaccine is effective in preventing oropharyngeal cancer and mouth cancer, which dentists, of course, seeing you several times a year, will check for. Many patients visit their dentist twice as often as they do primary care providers. So allowing the dentist to administer HPV provides additional safety and more convenient opportunities to discuss the prevention and the possibilities of risk with patients. Dentists administer far greater number of injections than their primary care counterparts. The General Assembly authorized dentists to administer COVID-19 immunization in 2021, and we all know that pharmacists have been giving vaccinations for years and years and have an excellent safety record. So with that explanation, I would, pending any questions, like to move forward.
Okay. Any questions for the sponsor of the bill? Okay, seeing none, let's vote on, without objection, voting on House Bill 2032. All those in favor say aye. Aye. Opposed? Ayes have it. Bill goes on to full health. All right, we have, I think, one more bill from the Ramsey calendar.
Ladies and gentlemen, I do appreciate your indulgence so much. I want to take just a personal moment here.
Okay. Yeah. Yeah.
I've presented this failing bill. So, let me do my last bill. This bill.
Okay. We are on item number 21, House Bill 184.
And I would appreciate
You're
a
recognized.
motion and second.
So approved.
Hey, one out of six ain't bad. And this bill I do plan on taking off notice. This is a bill to give full practice authority to advanced practice nurses. I know it's not a favorite of our chairman, but it's a bill whose time has come. I think over the pandemic we've seen that issues have just gotten out of hand, staff issues, and we see shrinking coverage in rural areas. And I know if nurses get full practice coverage, they're not all going to go to rural areas, but some will. And the ones that I've visited so far do a fabulous job, and they deserve the opportunity to move forward. We have lots of discussion about that they're not capable, and this bill has nothing to do with changing their scope of practice. They're not going to be allowed to do surgery. They're going to be allowed to do exactly what they're doing now in clinics, walk-in clinics, which most of you see them when you go there. So what happened, this bill was referred to a task force in the Senate. We're going to have, whether you call it a summer study or a task force, we're going to do that this summer. And so with that explanation and hope that you'll be cognizant of the importance of it, watch the proceeds, and next year maybe we'll have a bill that everybody can support. But with your acceptance, I'll take that off notice.
All right, without objection, House Bill 184 is off notice. All right, thank you. That ends the Ramsey calendar, and I will be handing the gavel back to our chairman.
Does anybody have any personal orders? I certainly do. This has been a very eventful 2 years. We're going to leave here with some people not liking us and some people loving us. But you guys have done a great job. This has been a fabulous committee to work with. We've never had to break for lack of a quorum at any time, and you've all been very astute and diligent, and I appreciate you so much. The questions have been to the point, honorable, and very personable. I want to thank all the staff that's in here, Rochelle Frazier, our clerk. Haven't met you. What's your name? Alexa, and Tony, our sergeant at arms. Appreciate all the folks that are working with us every day. See a lot of friendly faces, a lot not so friendly, but smiling.
Yep.
Yes, sir.
Chairman, I wanted to say what a pleasure it is to be under your leadership. You did a great job. We had some contentious bills, and you've had to call some people out in the audience a few times, and but we were behind you 100%. So just wanted to appreciate the committee that you ran this year.
All right. Good. Thank you. I've got hats here. It says House Docs Health Subcommittee, 112th General Assembly. So you guys are welcome to them. I'm going to save a couple of these pink ones for the clerk staff and send one to Robin Smith. So everybody's welcome to one when we're finished. Yes, sir.
Thank you. I too want to echo the sentiments of Chairman Jernigan. It's been a pleasure having you as our committee chair. I don't think that a lot of the public or a lot of people in the audience may not know getting some of these bills into shape. I mean, I've been subcommittee chair and I've had to deal with and get into shape. It's a lot of work to make it, and with the staff that we work with, and I just want to thank you for the job that you've done and the efficiency with which you've run the committee. So thank you.
Very kind, very kind. Do we have any other comments? We have a motion to adjourn, and so what we'll do is, I think we might have had a bill or two at the heel. We will roll those with the special calendar. We don't have to do any of that. We can just adjourn. Okay, we can adjourn to the call of the chair, and that's what we'll do today. So any further comments or questions? If not, all those in favor say aye. Aye. So approved. You guys grab a hat and let's take a picture up here.